All right, we are glad to be back and to have you guys with us who are online. We had a wonderful lunch, and we're looking forward to 3 more lectures before our Q&A this evening. We're going to take a couple breaks in there, so just be aware of that. We're going to do the breakout rooms. We're going to have some Q&A time, so be prepared for that, guys, and we will be chatting the link for you, again, into the side panel here on the Zoom software for the breakout rooms. So you should be able to get in there. And when you get in there, you're going to have to unmute your microphone and unmute and turn on your camera. And so look for those microphone icons, camera icons, and try to make sure you get in there. The goal, again, if you weren't here at the beginning when I talked about this, is to really make the lectures practical. So you're going to share information with your fellow veterinarians and just really help cement what was said. So with that said, our first lecture this afternoon is Dr. Jyl Rubin. And actually, I'm going to just briefly introduce Dr. Rubin and what she's about. Now, there's a lot of things that I could say, but we don't have the time for a lot of things because I don't want to cut into her lecture too far here. So I'm just going to read a couple things. Dr. Jyl has literally traveled the entire globe to broaden her extensive knowledge and embrace her love of animals. She has an avid interest in non-domestic exotic species, which is really what we're going to be focusing on in this lecture. She has during her 3 years of volunteering at a primate and large cat sanctuary, she gained valuable experience in dealing with problematic or exotic animals and pets. Dr. Jyl's focus as a veterinarian and media specialist is to be a positive influence in the way humans treat, interact, and coexist with domestic, wild, and exotic animals. One of the things you'll notice, too, of Dr. Rubin, if you go and look for her, is that she has she's featured monthly on their local Fox News channel as the veterinarian there, so she has some influence in the broader arena of pets and veterinarians, which is really cool. And so we're going to be just learning from her as she has used ozone now for a number of years in her practice there in the Sacramento area. So with that said, I am going to go ahead and turn it over to Dr. Rubin. You can go ahead and jump in here, unmute yourself, and share your screen like we just did before, making sure that it's the PowerPoint. There we go. We've got the audio. And I'm going to get myself muted at this point, I think. Take it away.
Good afternoon, everybody. It's actually morning here. I'm in California, so I got up really early to join this seminar, and it's just been fascinating so far. I decided to put a younger picture of me on the first screen. How many of you knew from a very young age that you wanted to be a veterinarian? I don't know about you guys, but you could see the date up there is 1965, so you could do the math. I was about 3 years old. And if you look off to the left in my little swimming pool, there's a ducky, a whale, and a turtle in there. And those were some of my very first memories of just loving animals and wanting to follow my dream. And this is such a passion for most of us that it's just been ingrained. And I think Dr. Siegel talked about passion in her previous lecture. Find your passion. Find what it is that makes you tick. And I think it's really important for veterinarians to know we're individuals. We practice medicine. There is a science to it, but it's also very creative thinking. I was raised in a family with very creative thinkers. My brother is a world syndicated cartoonist. So I grew up with a very funny sense of humor. And so throughout this lecture, you will see cartoons. Thank you, Lee Rubin, for letting me use those in my lecture. I think it's important to laugh. And if any of you have ever heard of yoga laughter or laugh yoga, you should look it up. It's pretty hysterical. And laughter is a very, very important part of medicine for people. It releases endorphins and circulation. So we need to laugh a little more. I think that's really important for us to know, especially as veterinarians and with the problems that are going on in our profession. We need to find some lightheartedness and enjoy our lives a little bit. So with that being said, I'm going to move into my first slide. I have a very unique practice. And I think it's really cool that Margot showed her practice in the last, and also Dr. Siegel. I didn't do that because I always felt really guilty about being the weirdo on the block, practicing holistic medicine and kind of hiding it for many years. But I have always had a passion for it, and I have a passion for traveling as well. So these are some of my cases. I'm going to run through these pretty quickly. But if you look at the black colored lizard up in the right-hand corner, I had traveled to the Galapagos. I have always wanted to see these black marine iguanas. I love reptiles. So I had the fortunate experience. I walked up to the Darwin Research Center just on a whim. That's kind of how I travel. And basically introduced myself and said, hi, I'm a veterinarian from the United States. I always carry my acupuncture needles with me wherever I go. And I said, do you guys have any sick animals? I mean, just off the cuff. And the head microbiologist who happened to greet me at the door said, sure, come on upstairs. We have a little black iguana, a marine iguana that was run over by a bicycle. And so I said, oh, great, I have my acupuncture needles with me. So I pulled them out and gave them acupuncture right there on the spot, you can see. And so some of these little guys here are actually from different places that I've traveled. The Savannah monitor that's laying in a box of ozonated water, actually, he was one of my patients at my practice. This guy was anorexic and very dehydrated. And also, we believe he had a liver issue. We were not able to do blood work. The owner didn't allow us to do blood work. But if you look here, let's see, I don't know if I have my pointer, if anybody can see this arrow. There is a bruise spot on his back, and that was from an injection that another veterinarian gave him. Reptiles have a tendency to bruise, especially if you don't get between the scales just right. And so we did a ozone bath on him, and he loved it, actually. Started drinking the water, and we used ozonated oil on that spot, and within a few weeks it was beautiful again. Off to the left is a tortoise, and then another little bearded dragon. You can see that those are face needles, actually, and the little beardy up there. I'm going to move into some cases, but I want to show you that I do a combination of different approaches. I have an integrative practice. I still love my Western medicine, and I love my Eastern medicine. So I get to have best of both worlds. So this is Alice. Alice came to me, and if you can see the first slide to the left, Alice came to me because her legs were chewed off, we think either by a raccoon or a rat in her pen. Several of her little pen mates had also passed away within the month. The owners couldn't figure out, they were just kind of curled up in their shell. They have several tortoises. And when they brought Alice in, you could actually see all the way into her leg, and you could actually, she had bone exposure as well. And so Alice lived in the clinic for about 3 months. We were able to use ozonated water flushes on her legs every day, and actually the ozonated soaks as well. We did cold laser therapy on her. We did a lot of wound care on her. I love wound care. It's one of my passions as well. And I like to try to heal wounds with as much natural medicine as I can. Sometimes we have to use antibiotics, but especially these little exotics seem to do much better with the non-conventional Western medicine. They do much better with some of the more natural herbals. So we used ozonated olive oil. We do a rotation on these guys. We don't ever use the same thing twice. Although we did use sugar, a lot of sugar to granulate the tissue. We used a product called Icon. I'm not sure if people are familiar with that. It is a surgical wound treatment, and it's almost like a colossalate that can be injected for abdominal surgeries as well. I use it a lot topically on my patients. We used Manuka honey, a high activity Manuka honey, Sylvadine ointment, which is great for reptiles, and then golden yellow ointment, which is from Jintang. It's a healing ointment, and it also helps relieve some pain. We did a daily debridement on her and a doxycycline injection every 7 days because this was into the bone. So we decided to cover our bases as well. Trying to medicate a tortoise every day is a nightmare. So we like to use these injections, and because doxycycline is every 7 days, we can reassess them at 7 days and see if they even need antibiotics after that. And then we gave vitamin injections once a week, which later in the lecture, I'm going to explain what those are. And then I also have an organic pet line of different odd type of products that aren't out on the market. So I've created an organic CBD essential oil shampoo, but it's a Castile base. It's a saponified coconut oil base. So it's very gentle. And we use that to clean Alice's legs every day. And then we rinsed her with the ozonated water. And she did get meloxicam daily because of the pain. So Alice, to the left there, you can see her, the wound is way deep, and both legs were chewed off. This is the third video is that, or the third picture rather, is her healing about 6 weeks in. This picture here on the left is about 8 weeks in, and then this is Alice today. She is totally healed. She has a couple of her little scales that are missing, but she's back in the herd and she's doing fantastic. And I really attribute the ozone to her. It did a fantastic job with those wounds. It wasn't painful. She loved being in the bath every day. So this is, we're going to move on to Iggy. Iggy is a 6-year-old male green iguana, and he came in for constipation, dehydration, and anorexia. And a lot of times I find reptile owners don't want me to do blood work. It's very interesting. A lot of times reptiles won't show their symptoms until they're pretty far gone, much like birds. And so, of course, I'm always hungry to do blood work, but they're not always hungry to do it because it's costly, and they want me to just fix their reptile. I will say that most of the cases I see with the exotics are due to husbandry, directly due to husbandry. I worked in Las Vegas for 5 years. I worked with all kinds of animals, primates and large cats. And Vegas, everything was legal there when I lived there. You could buy a baboon out of a pet store. It was crazy, but you could just buy one and take it home. And most of the problems and issues these animals had were husbandry issues because people don't know how to care for them. And so this little guy here also had metabolic bone disease, constipation, dehydration, and anorexia. So we made a little chamber. This is actually made out of a Tupperware container that seals really tight. We took the silicone tubing from, back we go. And you can tell that I'm a rookie. Let me get to that slide again. This is my first lecture, so bear with me. I'm not nearly as scientific as the rest of the speakers. So we took this plastic tub that you can see through. It seals really nicely. We put a hole in the top and we put the silicone hose in there directly from the ozone machine. We bubbled it through oil, and Iggy got a little ozone treatment in the chamber, about 5 minutes. We run it at about 40 gamma. I have now learned from Margot's last lecture that I think I'm over ozonating my acupuncture syringes. I've been going up to about 35 or 40. So shame on me, I'm gonna change that. But usually we do about 40 on these guys. And then we did rectal ozone on Iggy, and voila, he pooped terrific right after that. Also, we can do an adjustment on him. VOM adjustment works great on these lizards as long as the metabolic bone disease isn't so severe. And that also really resets their spine, but it also basically makes them poop really nicely. And then he also got an ozone bath as well. So in my practice, I also see a lot of pigs. Most veterinarians want nothing to do with them. I'm probably about 25% deaf as a result of working with pigs for so many years, but I love them. I think they're incredible animals. And they're really fun to work with, but they are very labor intensive. And so we do what's called a piggy tune-up. If any veterinarian out there wants to learn this craft or skill, please let me know, because I'm getting older and it's very hard on my body. I, like Margot, am also looking for an associate. I'll just throw that in there. At any rate, you can see up in the left-hand corner, my technician is dremeling the nails down from this pig. They were much longer. We trimmed them first, then we go ahead with a coarse Dremel. We Dremel them down. We sedate them with isoflurane. If you could see the mask on, this is Benji actually. I don't use injectables on pigs. I don't really care for it. When I started seeing pigs, I've been in practice 26 years. There was just no data out there really, unless it was a farm pig. And now we have Facebook groups. And so the pig medicine has really come very far. If you can see over here in the left-hand corner, these are the two types of Dremels we use. We actually use a coarse and a fine to freshen up the nails afterwards. And this is actually called a conformational nail trim. Pigs are extremely prone to arthritis. And we find, again, husbandry issues where people are letting these guys live in their house, sleep on their couches, sleep with them in their bed. They don't get enough exercise. They don't get fed correctly. They're usually on dry food, carbohydrates. I actually have my clients cooking for their pigs. We have them do a crock pot recipe with their pelleted diet. They are carnivores, and I find that a lot of people don't realize that. So we do a meat-based Chinese food therapy diet for these guys. If you see there's a kitchen spatula opening his mouth off to the left-hand side. He had a bad tooth that I had to pull. And once we get the tooth out, we flush that with ozonated water. We do a thorough flush on them as well. So I use ozone pretty much on every patient that undergoes anesthesia in some form or another. You can see we also allow our clients to pick out a toenail color. So Benji's mom liked purple, and so we painted Benji's toenails purple. You can see Benji going home. She's a little bit drunk still, but we don't let them go until they eat something. And if a pig doesn't eat, you know that's a bad sign. So Benji curled up in her sleeping bag in the back of the car and went home and did pretty well. She actually had some conjunctivitis. So we did an ozone saline eye flush as well while she was under anesthesia. And this is Pinky, appropriately named. Pinky was actually another female potbelly pig, a youngster that the owner by accident left outside in the broiling sun. And I don't know if you're familiar with Sacramento, but it gets to be about 110 degrees in the summertime here. And the owner left her out in the sun, and she got burned, unfortunately. I encourage all my piggy owners to use sunscreen. I make an organic sunscreen that has essential oils in it as well. Their skin can get very dry. And so this is the brand that I recommend. Everything is totally safe in there. It's safe for people, and it's reef safe. If for those of you who don't know about sunscreens, make sure if you're going to use one that it is reef safe, because our reefs are really taking the hit from all these chemicals. So Pinky actually got rectal ozone. We had done some X-rays and she was sedated. So she got rectal ozone that day. And we also sponged her down with ozone water. And her skin, it's just miraculous to see the sudden change that happens when you use ozone. But her skin was so much better after we just did a little ozone bath sponge on her. She was in the hospital for a couple of days on pain management, and we sent her home. She did great. The owner felt really bad because she left her outside without any shelter in the hot sun. And you could see her toenails are also painted. She had been seen by me probably about 3 months prior. We paint the toenails just because when we go to Dremel them, there's cracks and kind of little divots in there. So we just paint them for protection. We don't paint the bottoms. And people love it. It's definitely a good practice builder. One thing I'll mention is my practice is very unique. I've always felt kind of bad because it's never been a real super fancy practice. And I've had other colleagues in town that I've gone to visit, and I've walked in and they have, granite countertops and big giant poles or posts and gorgeous floors. And then I walk out feeling like crap that my clinic's like this. My clinic is next to my house. I have a special use permit. It looks like somebody's house that you're going into. There's pillows and cushions, and we have oranges out for people to eat. And it's a very down-home clinic. And I came home one night because one of my colleagues just built this miraculous clinic. And I said to my husband, man, I kind of feel like a loser. My clinic's like so tiny. And he says, Jyl, it's not what the clinic looks like. It's who's in it, who's practicing. So think about that when you're building your practice. It's a reflection of who you are as a veterinarian. This is my vitamin injection, and I've had a lot of veterinarians ask me about this. Long time ago, when we first started treating exotics or reptiles, there was an injection called Ingicom. I'm not sure if any of you remember that, but they took it off the market, and it was really fantastic for our reptile patients. And so I came up with this rainbow shot, we call it, because if you look at the injection laying there, it's kind of hard to see. It actually turns out looking like a rainbow when you draw them up in the appropriate order. So take notes on this. If you want to use my my data, we use this actually on everybody, not just reptiles or birds or exotics. Every dog and cat that goes under anesthesia gets a vitamin injection. We just feel like it's going to help their immune system. We are now trying to implement rectal ozone for patients that undergo anesthesia as part of their surgical package. And certainly every single dental cleaning that we do, no matter what species it is, gets an ozone flush. It's been the best, fastest growing modality in my practice, I think. I've been using ozone for about 7 years now. And I was really nervous at first, but it certainly has been very, very useful, helpful. And it's really interesting. People come from all over the country to see me for ozone. So just to finish on this, you draw these up in the order. The A and D is very thick, and you only need about 0.1 to 0.3 cc's in a 3 cc syringe. So I usually draw that one up first, then I go to the vitamin C. These again are in order of how I draw them up. The B complex, then the B12, and then the iron. And we draw them up in either a 1 or a 3 ml syringe, but you do need to use at least a 22 gauge needle because the AD is so thick. And then we just give it intramuscularly to the patient. So I'm going to talk a little bit about avian ozone. I see quite a number of different critters in my clinic. And I do see a lot of dogs and cats. Just on a side note, we'll talk about that. But because my lecture was based around exotics, I tried very hard to find all my exotic cases. This is Hanky. I saw Hanky about a month ago. He's a 10-month-old, or she actually is what the owner is calling her, a 10-month-old Mandarin duck. Very, very sweet. Hanky came in for an injured wing that the owner thought she broke her wing. But Hanky was very alert and active. She was eating great. We always feed them when they're at the clinic. We always have all kinds of fresh fruit and vegetables. And we have a little bit of all kinds of food, duck food, rat food, just in case the owners forget. But we always ask the owners to bring food with their patient. And that's something that's really important. I don't think, especially with COVID now and people dropping animals off, if you have that type of practice, which we do, we ask that they bring food, a food supply with them. But we also cook for all of our patients. We do crock potting every single day. I have a staff that crock pots for our patients as well. But Hanky was eating and drinking pretty normal. She was totally crazy about the raspberries we gave her while she was sitting in the clinic. When I did my physical examination, I looked at the bottoms of her feet, and you can see here she has a big black circle on the bottom of her web, on the bottom of her foot, and she actually had it on both feet, and that's bumblefoot. And bumblefoot is typically caused from pressure sores on the wrong type of, again, a husbandry issue, wrong type of substrate. This duck was primarily living on cement, had a little kiddie swimming pool, and she had several ducks in her yard. Hanky had a clutch mate that I saw about 3 weeks prior named Georgie, who couldn't stand up. His head was wobbly, real limber, never ever could walk. And so unfortunately, Georgie passed away. But before Georgie passed away, I tried to do some ozone on her. And, sometimes birds just keel over, and she was in such bad shape, but I thought, I have to do something. I can't just sit here and not do something. And she was so delicate, and we gave her actually cloacal ozone. And a few hours later, she just didn't make it. She was in pretty bad shape. She also had dysphagia. So if you could look at Hanky here, Hanky's actually standing in some ozone water, absolutely loved it. And if you look to the right, she started gulping it down like candy, just drinking it. I mean, how great is that for her? So she was delighted that she was standing in ozone water and just was drinking it like crazy. So this is a very interesting case. We went ahead and X-rayed Hanky because we thought she had a broken wing. She was holding it down funny. There was a little, like a blood spot almost on it. Maybe she caught it in something. The owner thought maybe she injured herself. But when we went to take her X-rays, and this is Hanky's X-ray, one of them anyway, her wings were fine. And so and of course, I'm looking at all the little tiny bones, and I actually called in Avian Consult. She specializes in avian radiology. I have some good connections with people. And I said, what the heck, this bird's wing is kind of funny. And then I gave her the whole history. And as it turns out, if you look down here, and it's hard to see, there's actually chunks of metal in there. And so we were concerned that she had some metal toxicity, and that her little buddy in her clutch may have died of either lead poisoning or some form of metal toxicity. So of course, immediately called the owner and talked to her about what was going on, that I didn't think it was a broken wing. We actually lasered her wing that day and let her sit in the ozonated water. And then I talked to her about this metal. I had made a recommendation to do a blood test on her, check her CBC and total protein. Sometimes those can be telltale for metal toxicity. And the owner declined, unfortunately. But the treatment plan, if she declined, was to do Metamucil for 3 days. I believe it was 1 tablespoon per pound. So mom was putting Metamucil in her for 3 days straight to see if we could get the metal to pass. And we called her every day just to make sure. I was really kind of nervous, thinking maybe the bird had lead poisoning. We had offered her also a metal toxicity panel, which are quite costly through Antec. But she declined again. And mom was great. She's very dedicated. She was giving the Metamucil. We changed the diet. We put her on kind of a soft diet because she was on her pelleted diet. And mom was sifting through duck poo. She changed the substrate on her feet. And then we also lasered her feet. We did not use any antibiotics on them, but I sent her home with golden yellow to be applied on her feet as well. But while she was in the clinic, we lasered them and used ozonated olive oil first, and then some Trameal, and then sent her home with a little tube of some golden yellow. So I talked to Hankey's mom last week. She's doing fantastic. She could not find any of the metal pieces in the poop, but she said, they poop so much, I'm not sure I could catch up with all of it. But her wing is totally back to normal. She's eating great. Her feet look almost completely healed, and she's doing really well. And this is a case that obviously had an infection, also potentially a foreign object. And we used no antibiotics on this patient at all, just good nutrition, laser, ozone therapy, and some herbals. So the next case I'm going to talk to you about is Henrietta. Henrietta is a little chicken that came in to see me, and the owner thought she was egg bound. I think she's about 1.5 years old. She was a great egg layer. And when I saw her, she was okay. She was a little punky. Her crown was a little bit dull. She was well muscled, but she was infested with lice. And we did an ozone chamber treatment on her because she also had a upper respiratory infection. And the chamber works great for that. Remember, again, to always use the bubbler with the oil in it. Don't ever use water because like Margot, who's had bad experiences, I too have had some. I actually had a hamster. I had a technician that hooked this up incorrectly in through water, and the hamster obviously got ozonated to death. So you need to be uber careful if you're going to do this. We have a technician that stands there for 5 minutes. I'm pretty adamant about that, and watches every move they make. But the wonderful thing about Henrietta is when we went to take her out, it's pretty amazing. Not one louse was on this bird. They were all in the bottom of the chamber. We actually got rid of all the lice on her just by putting her in the ozone chamber. I couldn't believe it. And this is one of my first cases with the chamber. So we also flushed her eyes with ozonated saline. She also did not get any antibiotics. I used DMG. I don't know if you're familiar with that, if you could see this in the camera or not. I didn't take a picture of it, but I use VetraScience DMG. I really, really, really like this for my little exotic animals. You can use it in dogs and cats as well. And I also use this Probios, which I don't know if you guys can see. It's actually a cattle probiotic, but I actually take this syringe. This is a 60 cc syringe. I put it into 12 cc syringes and I send it home with people because people who have chickens don't really want to buy a big giant tube of this. And I have them give a pea size every day, and it's a probiotic, so it will help their gut. We also changed her diet to crock potting, which she absolutely loved. And I know it sounds gross to feed a chicken, but they are carnivorous and they're cannibals. So she loved the diet. It was basically chicken soup, Jewish penicillin, and Henrietta did great. She came back in every other day to get her ozone treatments, and we never had to use antibiotics to clear up her upper respiratory infection.
We've got just a couple minutes remaining here, Dr. Rubin.
Okay, I was going to talk about mammal ozone real quick. This is Koopa. She's a 2-year-old intact skunk. Yep, I said it, it's a skunk. Very nervous. She had a very bad upper respiratory infection. These are some of the things that we used. I love Dr. Melissa Sheldon's essential oils. We also use those concurrently with our ozone. I used open air for this little guy and homeopathic nose relief as well as deworming. I have a cannabis product that I also make that's very gentle for small animals. It's a microdosing called Deja Drops. And she also got a vitamin injection and ozone eye flush. And we actually sent the owner home with some ozonated water for the day. And she made a full recovery as well. Just a side note, you definitely don't want to do rectal ozone on the skunks. This is a little guinea pig. Also, same thing, upper respiratory. We use the chamber a lot for our little guys. Kind of the same therapy. Also, I like to use this rose water spray on my guinea pigs. It's just straight rose water, but it has a lot of vitamin C in it. So when they go to groom themselves, they'll take some in that way. But we also use the Assisi Loop lounge on her, gave her vitamin C injections, and she also got sub-Q ozonated saline. She did great, made a miraculous recovery. This is Tippy, a little rabbit, and Sam is off to the right. Sam's one of our miraculous cases. Sam came to me 3 years ago. He comes in every week for ear ozone. He has severely sclerotic ears, and the owner was told by several veterinarians to have the ZEP surgery, have his ear canals cut out. This dog can hear fine. He has thickened ear canals with some cysts in them, but we do ozone flushes and ear ozone. So I thought if I could do it on a dog, we could certainly do it on a rabbit. So Tippy made a full recovery. He looks horrible there, but he had a Pasteurella infection, and we flushed his eyes with saline, ozone saline. We flushed his ears, got rid of his ear mites, and again, changed his diet and did some acupuncture on him and some cold laser therapy and made a full recovery. You can use ozone in ferrets as well. This is Charlie, a 6-year-old male ferret who came to me, hair loss. And I just as a question to you guys, he had, obviously splenomegaly, he had bruxism, diarrhea, dehydration. Again, we did rectal ozone, sub-Q saline, vitamin injection. I used my cannabis product on him. We do what's called duck soup. We changed his diet to a high protein diet because a lot of people feed the wrong diet to ferrets. And he's still under my care. There's about 5 things that ferrets get. Lymphoma, intestinal obstructions, insulinomas, adrenal tumors, and diarrhea. So he has insulinoma. The owners did not want to treat him with prednisone. So we are just and he's quite old. The owners wanted to be quite gentle. So we are doing, again, DMG, vitamins, ozone, and a major diet change, which has helped tremendously. My dose for ozone for these little guys, by the way, I use about 1 cc per pound. Just so everybody knows, you can see it's a small amount in there. And in conclusion, I'd like to say that whatever you can use ozone on in a dog or a cat, you could pretty much use in an exotic animal. Rectal ozone, subcutaneous ozone, the ozone baths and soaks work great for reptiles. I do a lot of eye ozone flushing, the ozone chamber, the ear ozone, nasal ozone. To be very careful with that. Sometimes we just use a little bulb syringe to flush. Dental ozone. You can do UVBI. We do UVBI. I didn't talk about that. It's very hard to do on some of these little critters, but some of the larger mammals it's fine with. The ozone oil, the ozonated drinking water, we offer that to them when they're in the clinic. You can actually do interstylomic ozone saline. We do that sometimes on the pigs because it's difficult to get subcutaneous fluids into them. And then I also do ozone acupuncture as well. And I learned a very valuable lesson today. I'm way overdoing it. I'm using about 40 gamma on my ozonated acupuncture. So I'm going to slim that way back. Thank you, Dr. Roman, for mentioning that because I had no idea. So in conclusion, I just want to make sure you guys have tried to keep it lighthearted and know that you can be as creative as you'd like and have as much passion as you'd like. Find your way and enjoy your career and try to not take everything so seriously all the time. Try to reflect on your day and know that you're doing a good job and that you're helping animals, which is one of the best things you could ever do on the planet.
Awesome. Well, a great reminder. And let's have a round of applause. And we're going to keep you with us, Dr. Rubin. We're going to transition now, of course, to a Q&A time. Thank you, though, for that lecture. So we do have some questions already here online. I'll start there. And if you guys have questions in here, Olivia will pass you the microphone. Raise your hand if you do so she can get it to you before we're ready for that. So, okay, so first question here online is from Dr. Bross. She says, can you tell us what kind of a chamber that is and where you got it? And maybe it'd be important to note that also you're doing it through oil first, right? So
yes, yeah. Never, ever, ever do that through water. Like I said, thankfully it was a Petco hamster that had really bad diarrhea and was almost, they like to bring them into me practically dead anyway. And I used to save them. I used to tell them, I'm not euthanizing any of your hamsters. I'll either place them in a home or you don't get them back because they wanted me to euthanize all of them. I gave a lot of hamsters away. But you definitely want to use oil through that. You don't want to hook it up to your water. That chamber is actually just something I got at Walmart, if you can believe it. It's just one of those storage containers with locking handles on it. Or you can get the ones that snap down. You want to make sure they're about as airtight as you can get. And then I just put a little small hole in the top with the silicone tubing coming from the oil chamber and just put it right into the chamber. Let's see if I can go back and see if there's some pictures there. Oops. You can tell I'm a rookie at all this, huh?
You're doing wonderfully.
There you go. So you can see the little guinea pig in here. We always put a towel in there. And a lot of times, like with the skunk, we actually put a blanket over it. He was freaking out so bad. Sometimes we'll put Rescue Remedy inside the chamber or spray the towel down, or we'll use the essential oils. And a lot of times we'll put them in the Assisi Loop, the little chamber. I don't know if people are familiar with that. There's a little soft crate. We'll put the animals in for about 15 minutes so they calm down. Then we'll put them into the chamber. But basically all I did was I cut a little hole in the top, we taped it up and ran it through the olive oil and for about 5 minutes. It's important that you watch these guys just in case they stress out or they don't have enough air in there. And sometimes they do, you just have to open it up and take them out. But it is really quite wonderful for upper respiratory infections and chicken lice, obviously. I wonder if they would have worked on Dr. Siegel's maggot case. That's kind of a cool thing to think about. I haven't thought about it for that, but if I have a maggot case, that's where they're going to go.
Great. So basically you're creating almost an ozone sauna, well, not sauna, but just an ozone chamber. It's not ozone, it's ozonides, it's peroxides in there. Right. So that's the real difference, which is why it doesn't matter what the material is on that stuff.
Right.
Yeah. Okay. So did we have a question here? Let's go ahead and answer that. Yeah, go for it.
Hello. I have a bunny with kidney stones, and she's kind of difficult to handle. You know, she likes to bite the owners. And I was wondering, do you have any tips for doing rectal ozone or anything like that for this bunny?
Well, I don't know if you have a loop lounge, an Assisi Loop. Sometimes even just around, if you have the loop, you could put it just around their neck. to calm them down, because it does work on stress. You can also run essential oils, stress relieving essential oils. I know Dr. Sheldon has some chamomile, I think she calls it. Also, excuse me, you can use Rescue Remedy, works pretty well on bunny rabbits. I don't really like to sedate rabbits. You can use cannabis on them, but you need to be very careful. The product that I make is a micro dosing, and it's actually, it's a very gentle, it kind of has a savory flavor to it. And so I actually developed that specifically for these little guys, because some of the other cannabis products are really, really strong. And so this is a pretty light dosing. It works great on the dogs and cats as well, but you can try some cannabis on them. Acupuncture, if you know some of the stress points, you could certainly place some needles in the rabbit as well. And then make sure that your rectal tubing is lubed pretty well, because it is hard to get. I've had technicians mistake which hole to go into on rabbits. So you need to make sure your technicians know their anatomy.
Good. Next question online here is, for ear insufflations, are you bubbling through oil or water?
We are bubbling through oil, absolutely. Yes, my technicians, I don't know if you guys saw the picture of Sam. Sam's so iconic in our practice. We just love him. He comes in literally like once a week for his ozone. So you can see Sam here has his ozone, or has the stethoscope in there. There's a towel down here. We usually wrap Sam's head with a towel. It seems to calm them down, and it actually puts the stethoscope into the ears a little bit further, because he has such sclerotic ear canals that it's difficult to get those in there. And I'm always concerned about my technician actually has to hold Sam. It's about anywhere from a 4 to 6 minute treatment. If they're not infected, it's 4 minutes. If they're infected, we go 6 to 7 minutes. But we typically wrap a towel around his head, and they do very well. I mean, it doesn't hurt or anything. They seem to do okay. I usually flush his ears first with ozonated water, and then dry them out and then put that in. I like to use that after I clean the ears, so I can get better penetrability, not having to go through an infection.
Good. Those are good tips. Okay, so another question online. Did we have any more questions here as well, or are we good here? What is DMG?
It's dimethylglycine. It's actually an amino acid that helps digest foods better, just in a simple Reader's Digest version of it. But it is considered a natural product, and it's by VetriScience. I'll hold that up. You can get it at MWI. It's a liquid. It does not have any flavor to it. So I really like it, especially for like the little ferrets, because you only need about 0.2 cc's once a day. You can hide it in their water as well, but I use it on the rabbits. Really any of the exotics, even the lizards. And sometimes you can even put it in a little squirt bottle and mist it onto them, kind of like the rose water. I like the rose water a lot as well, because it really keeps their skin hydrated. But the DMG is excellent for digestion and immune system. It will help with the immune system.
Wonderful. So the photo of the duck, Hank, Luana asked, had what looked like a diffuser in front of it. What were you diffusing?
I was diffusing Chicky Wicky, and I think I mixed that. I think it says on my slide. I think it was Chicky Wicky that I used. It's Dr. Sheldon. If you're not familiar with her website is Animalio or Animal EO. She has some fantastic oils specifically for animals. Yeah, that's, yes, see the little diffuser down there. We're really big into diffusing for specific, I have like probably every oil that she makes. We use specific oils for our cases. Now you can also make that into a spray. I think she has a recipe on there. You can use either fractionated coconut oil as a spray if you were going to put it on them directly, or you can use it as a misting as well. But I like to use my diffuser. And Chicky Wicky's great for any of your, your chickens, your ducks, your geese. They seem to do really well with that.
Awesome.